Cardiothoracic surgeon Dr. Alexander Marmureanu took the stand as an expert witness to challenge the plaintiff's diagnosis of thoracic outlet syndrome. Dr. Marmureanu testified that the symptoms didn't align with a diagnosis of TOS and lacked reliable medical support. His testimony dealt a serious blow to the plaintiff's case, calling into question one of their central claims.
What were you asked to do in this case?
Evaluate the medical records and formulate an opinion in regards to the presence of thoracic outlet syndrome. So when we talk about thoracic outlet syndrome, there is a neurovascular issue. What's neuro? Nerves, vascular, vessels. Nerves, it's called brachial plexus and lives right in here. So there are nerves coming from the spine, around the neck. This is called the scalene muscle. Goes around the clavicle, below the clavicle, above the rib, and goes to the arm. People will have symptoms. And what kind of symptoms? Mainly numbing in the last two fingers. Vascular, you have an artery and a vein. The vein, you get swelling of the hand. In order for us as a physician to help the patients, we have to properly identify, to do a very thorough workup. We have to do radiologic studies. First of all, an X-ray. Second, CAT scan, CT scan. Then we give contrast to look at the artery and the vein, CT angio. And then you see the vein is narrow, the artery is narrow, and where. We do electro EMG. We look at the muscle. We look at the nerves. Not an easy diagnosis. Routinely for thoracic outlet syndrome, 60 to 80% get better physical therapy. So everybody gets physical therapy. Well, she didn't. And I found this a problem for her because she deserves that.
When you're diagnosing problems that a patient brings to you, you're doing a differential diagnosis, correct?
Always.
And that means that you're trying to figure out what the possibilities are based on the symptoms reported to you, correct?
Correct.
And then you start testing to try to knock out one or the other.
Rule in or rule out.
Rule in or rule out. You said it better than I did. Until you get to the one that's in the bullseye, correct?
Hopefully.
Hopefully. And I think if I understood the deposition testimony that was read, the symptoms related to you in the medical records that Asia had could be other things than TOS, correct?
Honestly, TOS would be number 11 on a top 10 list.
Okay.
Out of her symptoms. I don't neglect her symptoms, but there are several other things that should be ruled out before you get to TOS in this patient. It's highly unlikely to get TOS from a trauma that there were absolutely no findings, no brain injury, no bone injury, no abdominal injury, no pelvis, no liver. I deal with trauma all day long. I mean, the people break ribs, they have lung contusion, heart contusion, you have a splenic hematoma, you have a tear in the mesentery, which is in the gut. There are signs for big trauma. She had none of those. So do I believe that this level of trauma will generate a TOS? Absolutely not, no.
Okay.
In this case, unfortunately, she had only one study done in 2017. It's called an MR neurography. That study was ordered from evaluated the left side and found problems on the right side. Now, if you don't understand me neither, okay? In medicine, we say 2 doctors, 3 opinions. In this case, there's a 1 doctor, 1 opinion. Surgeons, we measure 10 times and cut once, okay?
Were her reported symptoms consistent with a clinical presentation of TOS?
No.
In your opinion, was the diagnosis of TOS adequately supported by objective evidence?
No, I don't think it was supported by any evidence whatsoever. The reality is you cannot base the diagnosis on the wrong study.
Is it within the standard of care to subject a patient to Botox injections or a first rib surgery?
Well, first of all, no one should have surgery without a clear diagnosis, according to standard of care. And again, as physicians, we don't treat studies, we treat patients. So to summarize, there was no proper diagnosis to justify any sort of procedure.
So we got the top up there with left, and at the bottom under impression we have right. Is that what you were talking about earlier?
Correct. Do you remember the study was done for the left? Let's read the impression. Level of scaling triangle on the right side. But they just studied the left side. That's impossible. How can you do anything based on the study. When you look at the studies, the radiologist, or in this case, there was no radiologist, I found this to be a problem. Now, I'm board certified, I read all my studies, CAT scans, MRIs, but I do ask a radiologist, just because that's what they do. So no MR radiologist read the study. All those things being said, the study the way it is, it shows clearly there is no thoracic outlet syndrome.
All right, doctor, welcome back.
Thank you, sir.
I wanted to understand if you were saying that this is just something that can't be used by anyone, or it's just not something in your experience that you would use and have used personally.
Well, neither. It's not that something used in accordance to standard of care. In other words, people go to New York, usually they fly, and some people decide to take a train, or some people even drive. And so usually we fly. Doesn't mean that somebody can walk if you want. Same thing here. I don't argue with this. I think it's a good idea that those physicians from Columbia decided to use this study. But that's not the first test that's being done.
And the left-right issue, do you have any reason to believe that that wasn't just a typo where he put right when he in fact meant left?
But that's exactly my point. How can...
Calls for speculation.
Sustained.
When you reviewed that, it was your opinion that there was some confusion about whether Dr. Fuller meant had done a study on the left, but then made an impression about the right side of Asia Morgan, correct?
I can't put words in his mouth. I think it's confusing, and I will never treat a patient. I will repeat the study based on that report. That test is confusing to me and everybody else in regards to left and right, and that confusing test shows that actually she does not have thoracic outlet syndrome, as there is no narrowing. Clearly, he didn't think it was confusing because he didn't repeat the study, and actually he blocked both sides based on one study.
And doctor, it sounds like you listed a number of conditions that could be the diagnosis of Sarah Morgan's problems, and you think that there are more tests that need to be done to determine, is it that, is it TOS, is it something else? Is that fair?
No, that's not what I said. I said what you read to the jury. That's what I said.
Doctor, do you agree that Asia Morgan still needs a proper workup in order to determine what exactly are causing the problems she's having when she has pain in her upper extremities?
I truly support the full and thorough workup. Again, I didn't examine her. I only look at the records. All what I'm here to say based on everything I've seen, and you know by now, there is no evidence that she has thoracic outlet syndrome.
Take this hypothetical. You have Asia Morgan with the background history that you know that she has. She comes into you complaining of her symptoms. Would you continue to do tests on her to figure out what's going on, to rule out thoracic outlet syndrome, or would you just send her home and say, no, I do TOS, I can't help you, you need somebody else?
Well, that's actually what happens to the other two physicians. They send her home for 7 months.
No, I'm asking about
I'm
you.
just trying to understand the question. Clearly, there is no indication. If she would be complaining that she's losing muscle, she's got all sorts of nerve symptoms that would drive me to the conclusion that could be thoracic outlet syndrome, the jury would know by now what we need to do. I would start with nerve conduction study, EMGs. I would do angiograms. I would inject contrast. But that's not where I would start. I would start with the basic. None of those things were done here. Zero.
You agree that all those things should be done if they're indicated along the chain. So you do the basic stuff, then that it warrants more in terms of TOS. Maybe they come to you, maybe they don't. Just depends, right?
I fully disagree, actually. I have pain sometimes. We all do, and I'm not doing any of those things. So just because we have some pain in our hands and elbows doesn't mean that you should have a $64,000 workup. I disagree with that.
Nothing like this workup in the medical records?
Well, nothing like this workup or nothing like those complaints. All the complaints I've seen are general.